My name is Shanae Nguli, and the date today is October 21st, 2022. And today I'll be discussing surface anatomy for the anatomy portion, for the lab portion of our anatomy course. And I have my sister with me for my lab. So to begin with, there is her clavicle over here, right here, and this is part of the appendicular system. And then there's also her patella bone. I won't go there. This is also her patella bone, which helps bend her knee and walk around and run like this, walking, and it kind of helps you give movement on your legs. And then back here is the vertebral column, which is her spinal column. And this helps you stand up and stay erect and kind of gives you formation in your back and all over your top portion of your body. And then over here is her pelvic girdle. So this is where a lot of, where the femur bones are joined into sockets of the pelvic girdle, and they help you move around and walk around. And that is where your legs are connected to the top portion of your body. And that is part of your appendicular system. And then over here is her ribs over here, and inside the ribs there's many internal organs, which are vital portions of your body, and the ribs are part of your axial skeleton. And then in her hands there's the metacarpals over here, so there's 5 metacarpals over here, and then her phalanges over here. They make up the bones in her hand, and they are part of the appendicular system. And then in the center over here is her sternum, which is part of the axial skeleton. And in her arm right here is the humerus bone, and this is the bone of your upper arm over here, and it's one large bone, and that is part of your appendicular system. And similarly as your arm, within her thigh, there's the femur bone, which is the largest bone of the body, and that is also part of the appendicular system. And at the end, there's the skull, which is your head. It is your entire cranial system, your cranial bone, and that is part of the axial skeleton. And within the skull, there are further many other bones known as the cranial bones. In your skull is where also the brain is housed, and many other cranial appendages such as your eyes and your nose and various other anatomical appendages. And so now I'll be getting into the importance of surface anatomy a little bit. So surface anatomy, which is also called superficial anatomy, and visual anatomy, is the study of the external features of the body of an animal. In other words, surface anatomy, which is a branch of gross anatomy, is a study of the form and markings of the surface of the body as they relate to deeper structures. It deals with anatomical features that can be studied by sight without dissection. And so surface anatomy is important because understanding and using surface anatomy is key to interpreting normal anatomy on medical images, being able to describe the location, appearance, and relationships of palpable anatomical structures. It is the definition of usable anatomy. And knowledge of surface anatomy is essential in performing a physical examination, treating diseases or dysfunctions of the body, and maintaining physical fitness. And specific, knowing where muscles and muscle groups are located can be extremely important in maintaining physical fitness. Surface anatomy is a core clinical skill for physicians, physical therapists, and other healthcare professionals, as palpation in specific locations can lead to rapid diagnoses in certain cases. It is also used in surgery to determine the appropriate place for incisions or insertions of a trocar in the case of minimally invasive surgeries. And in many medical and paramedical professions, the surface anatomy of a patient is of immeasurable value in diagnosis and treatment. For instance, knowing where to record a pulse, insert needles and tubes, listen to the functioning of internal organs, or take radiographs and perform physical therapy requires the knowledge of all the surface landmarks. And now getting into the clinical applications. When a doctor is observing where to inject epidural in a woman's back during her pregnancy and during her labor while she's giving birth, it is important to know the surface anatomy of the spine to understand if the epidural should go in the cervical, thoracic, or lumbar sections of the spine. Specifically, the first step after the patient positioning is to identify the target level and spot for epidural placement. This is done by palpating the two spinous processes, which are the vertebrae and the spinal column, and then corresponding with the desired spinal level for placement within the space in between those two processes, which is called the epidural space. And the target area for needle insertion will be between these two processes, which is the vertebrae and the spinal column. And so once identified, an antiseptic solution is used to cleanse that target area. And then once the skin is dry, then the doctor can proceed towards the process of inserting the epidural needle. And for the next clinical example, I'll be discussing the Heimlich maneuver. The maneuver is usually used on individuals whose life is endangered because of choking caused by windpipe obstruction. And it is important to understand surface anatomy because you have to make sure your hands are positioned at the right spot, which is below the ribs, and around the umbilical area. There have been many cases when this maneuver was used and ribs are most commonly broken. And so it's important to understand where the ribs are and understand how the maneuver is being used so the ribs don't get fractured or broken in the process of the maneuver. To show a little bit of a more visual aspect of where the epidural is usually placed, it's usually placed within these areas of the back for a woman who is in labor, and you would palpate the spinal cord with the vertebrae to see which area is the target area for the epidural. And then for the Heimlich maneuver, so you have to make sure you're doing it towards the umbilical cord, the umbilical section of the ribs and abdominal area, so that the ribs over here do not get fractured or damaged. So over here and going up, but you have to make sure that you know the anatomical, the surface anatomy of where the ribs are located so that those are not getting fractured or damaged in the process, and also understand where the pelvic girdle is so you're not hitting the pelvic girdle when you're performing the Heimlich maneuver or any abdominal thrust type movement. And that is my lab video for this week for surface anatomy. Thank you.